so much for inviting me to come and speak today. It's lovely to come and chat to you all about some of the work that we're doing in Tameside and Gloucester. So, my name is Emma Delaney and I am the Digital Health Lead at the Bureau in Gloucester. I'm going to talk a little bit about the project that I lead, which is called the Digital Healthcare Support Service, which I do realise is a little bit of a mouthful, but we got far too far down the road to change it. So now we just have a nice logo, so hopefully that makes up a very long name. So for those of you that don't know me, I recognise a number of faces in the room, but I think there's a number of people that don't know who I am, or maybe are not sure what the Bureau is. So, first of all, the Bureau is a voluntary sector organisation based over in Gloucester. So that is where I'm based, that's where I work. But this project is a little bit different from what we normally deliver at the Bureau. At the Bureau we have a range of different projects, including things like, we've got our social prescribing team, which is a really key linchpin of what we do at the Bureau. And then we have a range of other projects that we run, a lot of which include volunteers. So things like a befriending scheme, Core Companions, a life skills course, routes into work, a car scheme for people's medical appointments if they wouldn't have the lives to be able to get there. And we are obviously very closely connected with the healthcare service, particularly in Gloucester. But we have also had links with Tameside, where obviously Gloucester was previously in Tameside and Gloucester, and now it's moved over to Derbyshire. The project that I came into post as project lead in 2021 was originally commissioned by Tameside and Gloucester CCG, as was. And the idea of it in the first instance was to look at supporting patients with health apps and online healthcare resources. It wasn't a particularly specific remit, to be honest, at the beginning. And we went in thinking we'd do a lot more work with long-term condition apps, helping people to support their own health more successfully using digital. And what we found very, very quickly was that one of the biggest problems is GP access online. Again and again I was chatting to practices and finding and patients, finding that was a really key thing. Appointment demand was higher than appointment capacity, and there were a lot of problems with patients accessing the care they needed. So over the course of the project, we have learned a huge amount, and I think us in the voluntary sector, we obviously don't know general practice in anything like the detail that everybody in this room does, but through working with a lot of different practices now across Tameside and Gloucester, and there's 36 practices across there obviously, and we are currently, we've worked with over 20 of those practices in some capacity at different times over the last 2 years. We've observed a lot in general practice, and then obviously approached patients and spoken to them in a lot of detail, and sort of matched up in the middle to figure out what's going on in terms of how digital is being used in general practice to either try and improve the situation for both patients and practices, but also just to try and meet some of that demand and deal with it in a more efficient way. So the main things that we support patients with are GP online services, which includes some of the apps where you can access things like medical records and prescriptions, and then online consultation systems, which have obviously come and been much more heavily used since COVID. I know that a lot of different systems were thrown at general practice during COVID, and it was very difficult to make sense of what was out there. So practices just had to implement those very quickly, and we've been looking at a little bit of the effects of that. We have looked at different condition-specific apps and platforms, things like the My Health suite, which has things like My COPD, My Heart, My Asthma, the Fizzy app, which is used by the Connect Health team in Stonebridge, Diabetes My Way, And then we are also doing a little bit of work looking at some other health apps and platforms. Specifically, the Quell platform is something that we're focusing on at the moment, trying to get the word out there in the Greater Manchester practices that any adult can access Quell free of charge, and that has an online chat counselling component, which is, I think, an absolutely phenomenal resource for anybody, patients, the general population. It is an absolutely amazing resource that we're looking to promote. Then obviously we've been looking at the general digital skills needed to facilitate that access to all of these different apps and resources, and how that then supports general digital inclusion, connection and well-being. And then also, I know some of you will know me through coming in and doing various training and practice stuff, and just trying to help staff make sense of the minefield of apps and resources out there, and make sure that practice staff are feeling really confident with what they're saying to patients. And that's all been built up through us working with lots of different patients at different practices and figuring out what these patient-facing apps look like and how people can make best use of them. So the first thing that I just wanted to acknowledge is that, I should say there, sorry. Our whole model is based on a volunteer-led way of working. So I have 25 digital health champions that we've recruited either through GP practices, PPGs, or just generally the community. And we have currently 5 weekly digital health workshops that run across Tameside and Glossop, in Duckenfield, Hyde, Stalybridge, Denton and Glossop. Those volunteers are the ones who deliver that training one-to-one but within a group setting. So it's a real meeting of patients who are passionate about helping other patients to access these resources in general practice. So that's how our model works. And we do offer home visits to patients who can't get out. For example, who have additional needs, we might book different types of appointments for them. For example, a couple that I worked with the other week, we booked a BSL interpreter through the practice, and were able to use a room in that particular practice. The practice manager. That was a really fantastic coming together of the GP sending over the referral and us being able to work really closely with the practice to get those patients the support they needed. As I said, I want to acknowledge that there are a lot of issues and challenges with digital within general practice and healthcare in general. The first of which being that there are a number of different systems available. You may be completely aware of this, but I thought it was useful to lay it out in black and white the number of different systems that there are even just in Tameside, Glossop and Oldham. So on the left, I've got the different medical record apps that we support people to access. So you've got the NHS app. Obviously, there's a big national drive now to get people on the NHS app as opposed to potentially some of the other apps. On the basis that a lot of development has gone into it, and a lot of work has gone into making it very patient-friendly, integrating lots of different systems with it. We do still support patients with other apps if they would prefer those, and we do make sure that they know what those other apps look like and what the opportunities are on those apps. But we do find the vast majority of patients that we work with prefer the NHS app because they tend to be the less digitally confident. So the way that we identify patients is we work closely with different practices across Tameside and Glossop, and they will then identify patients that need that support, and they will send them over to us as a referral. Very helpfully, we're able to use Elemental, the sort of prescribing software, which is integrated with the vast majority of GP practices in the area. So they're just a few of the medical record apps. You've then got so you've got patient access, Evergreen Life, which I know is more heavily used in some practices than others, depending on what online consultation system they're using. And then you've got My GP, and then Airmen System 1, which are the two TPP apps. So that's even just in one area. That's all the apps you can use to access your medical records, prescriptions, and proxy access. On the other side, I've got all the online consultation systems that we have in operation in the area. AccuRx is becoming much more heavily used. You've then got Patches, eConsult, and Engage Consult, none of which are currently being used in Tameside and Glossop, but I believe that they are being used in Oldham. You've then got the ENIS online consult, the Acton one. You've got Ask My GP, you've got Footfall. What makes it incredibly difficult both for practices and for patients is this. The NHS app integrates with AccuRx and now thankfully Patches, eConsult and Engage Consult. Patient access only integrates with the ENIS online consult. Evergreen Life only integrates with Ask My GP. And My GP, Emergency System 1 online don't integrate with anything, and neither does Footfall. Footfall's just available on the website. That, I think, is a really key visual depiction of why digital in general practice is an absolute nightmare, because that, for all of you to get your heads around, is absolutely ridiculous, to be honest. Take that a step further and try and get patients to understand why different practices are using different systems. Things are all set up slightly differently. Different systems only integrate with different apps. It becomes very, very challenging to make sense of digital within general practice. So that is a really big one that I wanted to highlight, that I know is hugely difficult for you as in general practice to navigate. Then identifying and establishing the best combination of those resources for you, your practice, your patient population and the staffing model that you've got, again, is another massive challenge. Different systems might be more appropriate for different practices or different cohorts of patients. If, for example, one system is looking at a translation element and you've got a very high number of people who are second language English, that might be something that is more heavily considered. If you've got a much more digitally engaged population, potentially you can look at something where there's a login. It's a minefield, basically. Once you've got a system in place, then the complexity of the workings of that system and where to find different things on different apps and on different online consultation systems, again, is very difficult. And I find very often that for practice staff, they know their side of the system pretty well, but then the patient-facing side is really challenging because either you've got to find a test patient and then figure out where everything is on that. The NHS app is notoriously very difficult to get a test patient for, and so therefore practice staff are trying to explain something that they actually really are struggling to be able to see. So that is definitely a big challenge. Then obviously having the time, resource and capacity to train the staff on these systems. Really you want it to be intuitive so that you don't have to spend a huge amount of time training staff. Unfortunately, it's not as intuitive as one might like. You then have the issue that not all practice staff are confident with technology, which is a huge challenge. I think that hasn't been acknowledged particularly in NHS England when bringing in all these systems. It's not thought about, but actually you've got maybe admin staff who, once they're on a system and they know it, they're okay with it, but then trying to help people with what is actually quite complex technology really wasn't in their job remit. So that is another big issue we come across. And then, of course, ensuring that there is a really good, solid alternative for people that cannot access digital, even if you bring in a really good suite of digital systems. And then finally, communicating the benefits of digital and communicating that that the implementation of a new way of working to patients is another massive, massive challenge that I feel in the voluntary sector is a really interesting position to come from, because we can speak to patients completely impartially, whereas it's very difficult for practice staff, I think, to approach patients and say, we've got this new way of working, and as soon as you mention online, it's like a shutter goes down and patients go, I have to do this online now, oh my goodness, the only way to contact my surgery is online, this is terrible. And that's not at all what you're ever saying, but I think that is what patients hear, also thanks to the media. So that's the challenges, or a lot of the challenges that we have noticed coming in to an environment that we knew nothing about basically before doing this project. As I said, speaking to lots of patients, speaking to lots of practices, and trying to unpick what is going on. So, that was all of the doom and gloom, all of the challenging bits. Now I wanted to go through some of the benefits that we find when we work with patients and with practices that have brought in digital systems. It is challenging to get a good combination. It does take a little bit of time to tease it out, I think. And in some practices, actually, digital isn't always the best way. It's not always the most appropriate thing. But where practices have brought in digital resources, and I think particularly for practices with much larger patient list sizes, it is almost becoming the only way to deal with the demand, where there is that lack of capacity there for everybody to see a GP as they might have done previously. So the things that we find for patients is that it is an awful lot more accessible for patients who cannot access their surgery. If they're able to do their prescription online without coming in and popping it in the box, if they're able to have a video consultation without leaving their house if they're housebound, telephone appointments are really brilliant for a lot of patients. It is a lot more accessible. It also offers a lot more flexibility and choice for patients in how they access and when they access GP surgery. So for somebody, for example, that's doing a school run, phoning up at 8 o'clock to try and get an appointment is really, really challenging. So they may actually need to see a doctor, but then have to leave it for quite some time until they become really, really poorly, because it's so challenging for them to get an appointment. So where they can just, if there's an online triage system in place, for example, they can just pop in a form when they've dropped the kids off at school, come back. That makes life an awful lot easier, and they're much more likely to reach out to the GP when they need it. As I mentioned, we've also found it really beneficial for patients with some additional, with any additional needs, particularly hearing impairment. There's a few deaf patients that we've worked with now, people who have mental health issues and struggle to phone up. And again, those for whom English is not their first language, they can use things like Google Translate, which is, I know, not ideal, but it does then mean that they don't have that barrier of trying to phone, not being able to make themselves understood, and then potentially not trying again because they have too much of a barrier. Again, obviously, I know Emma's done a huge amount of work with patient access to records, and that increased information sharing between patients and practices, as I know you've named the Partnership of Trust, is so important. Patients being able to have access to their own records. We do get the odd patient who goes, no, I don't want to know, I know what's wrong with it, I don't need to see it. And obviously that's then their choice as well. They find access to records, that's absolutely fine. But for the vast majority of patients, it's a really, really positive thing. Patients can access all sorts of things like test results, documents, their record of jabs without ringing the practice, which then has the knock-on effect of reducing phone traffic coming in for those requests. And I think, although I know that there is a lot around health literacy, which obviously would contradict this next point, online triage does allow a patient to put what is wrong with them in their own words. They're not trying to quickly say it to a receptionist over the phone, and they're able to communicate a bit more slowly and carefully what they feel they need, and maybe have a bit more to think about it than if they're on the phone and feeling like they have to get through as quickly as possible just to get that appointment. And in practices where an online triage has been put in place, we do find that patients do tend to get the care they need the first time, rather than maybe seeing a GP for something that needs to be a physio appointment. They might be funneled straight off to a physio referral rather than even coming into contact with a GP, freeing up that appointment for somebody else. On the other side of things, for practices, online services do tend to massively reduce phone calls and make it easier for those patients that do definitely need to still use the phone to get through. And that is such a key one that we are really keen to say to patients when we are promoting these online services. At no point are we ever going to force anybody online, and that's a really strong message that I think needs to come through more nationally, because there is a lot of this negative media about online and patients being pushed away and never being able to see a GP. I think in a lot of cases that's absolutely not what's happening, and I think that's causing far more problems with patients having a perception of how difficult it is to access a surgery when that's actually incorrect. The reduction in admin tasks when patients can do things like their prescriptions online, I know that it does bypass some of the admin processes, which, when you look at the number of repeats coming in, does have a massive knock-on effect with the amount of practice staff time being taken up. And then again, taking calls for things like test results, document requests, fit notes, all of that, it can be done online. It allows a practice to deal much more proactively with the demand that's coming in rather than reactively. So rather than everything coming in on the phone and it being a bit of a panic to get that patient what they need, it's possible for somebody for an appropriate person to be triaging all of those forms that are coming in and dealing with that a little bit more calmly. When I've been into practices and they've just implemented an online triage system, it does have a massive impact on staff morale. I was literally in a practice the week before last who implemented the Accurex system, and they said that it completely transformed phone lines literally on day one. The phone lines were much calmer. The reception staff were so much happier. They found it a really brilliant system to use. And everybody after that first day was going, why haven't we done this sooner? It was absolutely fantastic. And that was obviously with it being resourced quite specifically in the background with the triaging and such like, which I know, again, it depends on the practice being able to resource it that way. Again, if a GP has a bit more information on an online triage form prior to a consultation, that does then mean that conversation with the patient is a bit more informed, and means that the patient might be prompted to think about what they've said in the form. Maybe they've said something they didn't quite mean in the form, and then it can be further discussed rather than starting from a blank canvas and reading those speakers and patient. I just wanted to finish with a little bit of patient feedback that we've had. These are some of our workshops that we have. I just thought I'd share some photos so that you can see the sort of environment that we're working with patients. As you can see, it's very informal. We tend to try and get tea and coffee and biscuits in wherever we can to our workshops, just to make it a really nice informal environment. But just the message that I wanted to get across today is that I think that digital resources get a little bit of a bad rap in some circumstances, and particularly that communication of them to patients is really, really challenging to get right. And I think it's a real work in progress as well, particularly impacted negatively by media input and other patients from other practices saying, oh, it's impossible to get an appointment. and actually a different practice is absolutely not. We had someone after one of our workshops who was extremely excited and felt they'd achieved something through being able to suddenly do their prescriptions online and learn how to contact the GP online. I loved the final bit. I told everyone with ears that I was digital. And this is direct quotes from the feedback forms that we get, so they're sometimes quite amusing. We also had somebody that said, I feel more in control, which I thought was a really powerful statement. Another person said, I enjoyed learning how to do my repeat prescription and being able to get test results and ask questions. I had no idea how to use my phone like this. It's been absolutely fascinating. People just don't realise the range of things that they can do at their GP surgery now in a lot of instances. And I think it's really empowering and exciting for patients to be able to use these resources and be a bit more independent, which comes on to my next one. It enables a lot of patients to be able to do things independently where previously they might have been relying on a family member to do something for them, let's say they're housebound or a friend. These resources can help people act independently for longer, and I think that's one of the things that we see time and time again. Even if we get someone quite resistant to the online resources, we spend time explaining to them why it could have the potential to benefit them, how it's benefiting the practice as well. That usually gets patients a lot more receptive when they realise that it's making everything within the practice work a little bit smoother. And when they just understand what's available to them, and that it does actually have the same result as phoning up, and sometimes a much, much better result. So that's probably the final thing I just want to leave with today, that there is a way through all of these online systems that seem a bit of a minefield, and that actually if they are implemented in a really positive way, patients do respond extremely well, and a lot of the work that we do is having those conversations with your patients, making sure they really understand these resources and the ways that they can benefit them and practice. I will finish there because I think I've gone on longer than I should have done. But if anyone's got any questions, I've put my email addresses and phone number if anybody wants to speak about any of those sort of online access to my website. Very much.
Emma came to see me about 3 years ago, I think it was, because she'd been given this remit and didn't really know what it was about. And to just, I didn't know you were going to do this presentation, so for me to just listen to hear someone who's kind of converted all that stuff that's flying around in our heads into something meaningful, to be able to see how she's spreading it across practices and things, it's just incredible. You have an amazing resource.